Avid rock climber and scuba diver just beat the biggest challenge of his life, brain cancer. New technology being used here at Sharp Grossmont Hospital makes tumors glow so doctors can easily target bad cells. Jenny Day joining us now with this amazing story. Jenny.
It is amazing, and you're about to meet Chase Leoncini. At just 25 years old, cancer was taking over his brain. But thanks to the incredible strides being made in cancer treatment at Sharp, he is now a cancer survivor. One day he was scaling a mountain and exploring the depths of the sea. The next, he was in a hospital bed in fear for his life.
And they go, well, you had a seizure. And I go, why? And they said, well, you have a brain tumor. And I said, can you take it out? And they go, yeah, we're going to take it out in like 5 days. And I was, it's just shock that, you could wake up with your biggest fear.
Up until then, 25-year-old Chase Leoncini was fit and healthy, or so he thought.
It's kind of a blessing in disguise, really, because I would have never known. I had no symptoms. I would have never known that I had a tumor the size of a baseball, nearly.
His fiancée remembers the day everything changed.
He fell on our table and went into a full body seizure, and it was like nothing I've ever seen before. It was horrible. He turned purple, like foaming at the mouth.
Neurosurgeon Vik Udani says at that moment, Chase's tumor had finally grown large enough to irritate his brain and trigger a seizure.
Pretty much always there's going to be some symptom that leads to the tumor being diagnosed. Usually it's things like headaches, seizures are very common.
Chase is alive today because Sharp Grossmont Hospital was one of the first to use this breakthrough technology.
Off to the OR.
I got suited up and sent into the sterile environment so we could see the machines that make this new procedure possible.
The other big thing now that we have is something called tumor fluorescence, where we inject a fluorescein dye in the patient about an hour before surgery. What that dye does is that it basically goes into the brain where the blood vessels are leaky, and usually those blood vessels are going to be the leakiest in the tumor. So what it essentially does is that it lights up the tumor. So all I have to do is I flip a switch here, which changes the filter on the microscope, and all of a sudden I can see certain areas of the brain glowing.
This makes surgery more precise than ever before. Until now, removing too little tissue meant the cancer could grow back. But taking too much could leave a patient unable to speak or move.
Our greatest tool are these microscopes. The microscopes basically integrate the image guidance so that I can look in this lens and see not only what I'm doing in the patient's brain, but also, like a picture-in-picture, I can have my GPS there, which will show me the MRI scan and show me exactly where in the brain we are.
Here are Chase's scans before and after surgery. The future looks bright.
Brain tumor surgery doesn't have to be seen as something that's fatal. There's definitely hope for people like Chase and others.
So much hope. Now, Chase just had this surgery 5 months ago and is now essentially cured. He does not need any follow-up treatment, but will do MRIs every 6 months just to be sure. Incredible stuff. Jason, back to you.
Wow, great job, Jenny.